Hypothyroidism is a condition in which our thyroid gland releases decreased amount of thyroid hormone. That is known as hypothyroidism. So normal physiology of thyroid gland is it is located in front of neck, and it releases T3 and T4 hormone which balance our metabolism of the body. So triggering factor comes from hypothalamus, and TRH, thyroid releasing hormone, stimulates the release of TSH from anterior pituitary gland, and from anterior pituitary gland it goes into thyroid gland and act there to release T3 and T4 which is present in front of the neck. So in this way this circle and this cycle works. Now hypothyroidism is a condition there in which decreased amount of T3 and T4 is released, that is known as hypothyroidism. Okay, hypothyroidism is a condition in which there is decreased amount of thyroid gland released, and decreased secretion of T3 and T4 from thyroid gland is known as hypothyroidism. There are different causes of hypothyroidism like primary hypothyroidism, secondary hypothyroidism, and there are also other causes of hypothyroidism. And primary hypothyroidism includes idiopathic hypothyroidism, Hashimoto thyroidism, irradiation of thyroid, or subsequent to Graves' disease autoantibodies are formed against thyroid gland, which causes destruction of thyroid gland, and it results into hypothyroidism. Surgical removal of thyroid gland can also cause hypothyroidism, and thyroiditis or iodine deficiency can also create the problem of hypothyroidism. Now, secondary hypothyroidism occurs means cause is other in other organ other than thyroid gland. So it may be in pituitary hypothyroidism or congenital hypothyroidism or pituitary necrosis like Sheehan syndrome. It can also create the condition of hypothyroidism. Other causes are drug may cause hypothyroidism like amiodarone, lithium, and interferon, or infiltrative disease like sarcoidosis, and hemochromatosis can also create the condition of hypothyroidism. So in this way hypothyroidism occurs. Now clinical features of hypothyroidism is fatigue, weakness, patient may develop weakness, and weight gain will be there. It is the significant finding of hypothyroidism. Patient will increase weight despite decrease difficulty in weight losing, despite decrease in appetite patient will gain weight, and there will be coarse dry hair loss will be there, alopecia, sick and cold intolerance will be there, dry rough pale skin will be there, muscle cramps, constipation will be complained by the patient. It is also second significant point to diagnose hypothyroidism is constipation, deep depression will be there, irritability, memory loss, and abnormal menstruation will be there in the patient. So hypothyroidism patient clinically present with weight gain, constipation, alopecia, and cold intolerance. These are clinical triad of hypothyroidism, and diagnosis can be made according to these clinical findings. Now, patient will lose hair, and alopecia will be there, dry coarse sparse hair will be there, lateral eyebrow will be thin, and periorbital edema will be there, puffy face with dry skin will be there in the patient. Risk factor: older women whose age is greater than 60 are more prone to develop hypothyroidism. Having autoimmune disease like SLE or other autoimmune diseases, our patients are more prone to develop hypothyroidism, and patient having family history of thyroid disease, patient are more prone to develop thyroid disease. Or radioactive iodine patient taking are prone to develop hypothyroidism. Now, the complications of hypothyroidism: patient may develop goiter, swelling in front of the neck, or heart problem may be there because hypothyroidism patient present with bradycardia, and ankle reflex will be delayed. So heart problem can be there. Mental health issue can be there. Peripheral neuropathy will be there. Myxedema, infertility, and birth defect can be there in the patient of the hypothyroidism. Now, the investigations for hypothyroidism will be thyroid function test like Meyer T3 and T4 in the patient, and T4 level are decreased in hypothyroidism, and TSH will be increased in hypothyroidism because our body will try to reflexly increase thyroid secretion. That's why it will increase release of TSH from anterior pituitary, and it will increase in serum in the patient of hypothyroidism. Now, thyroid antibodies or isotopes can also scanned uh, to find out whether it is autoimmune disease or grave disease hypothyroidism. and in order to differentiate types of hypothyroidism, and these autoantibodies are also screened. Now, how we manage the patient of hypothyroidism? We will manage the patient by treating the patient with levothyroxine replacement. First, start low dose with 50 milligram per day for 3 weeks, and then increase the dose to the double, to the 100 milligram per day for next 3 weeks, and finally to maintain dose from 100 milligram to 150 milligram per day. And levothyroxine should also be given to the patient with OD, because its half life is 7 days. And also there should be there should be contraindicated ischemic heart disease. And ischemic heart disease, these are the contraindicated, so we should take care of that. And in this way we can manage the patient of hypothyroidism by giving these two drugs, levothyroxine and liothyroxine. So that was hypothyroidism, and we discussed this. It is a condition of thyroid gland, and decrease amount of release of secretion of T3 and T4, which results into different clinical features like coarse facial features, edema, dry skin, cold intolerance, constipation, weight gain, and the patient will have bradycardia and heart problem as well. So we treat this condition by giving uh, thyroid medications and tablet forms of levothyroxine and liothyroxine, in this way to maintain the patient body metabolism and the function of thyroid gland. So that was thyroid gland. In next video we will discuss hyperthyroidism, which is against this one, which is inverse of hypothyroidism.